Hello, welcome to my videos. Today I'm looking at something slightly different, and this is a recent article and video that came out, Asian blepharoplasty in a 9-year-old. And I really wanted to talk to you about this regarding, I would say it's a controversial subject, cosmetic surgery in children, and what are the medical ethics behind this. And so
we're about to go meet a 9-year-old girl who was advised by her mom to get double eyelid surgery. It's a procedure that adds an extra fold in your eyelid to make your eyes look bigger.
In looking at this, well, what's the actual story? Well, this 9-year-old girl based in Japan called Micchi, she underwent double eyelid surgery to improve the appearance of the eyes. And for those of you not aware, 50% of Asians are born without an eyelid crease, which gives more fullness to the eyelid. And it's well been sought after for beauty and aesthetics to have a double eyelid crease, because this tends to make the eyelid look bigger. And when the eyelid looks bigger, it tends to look more open and larger and often more feminine. And so it's quite an attractive characteristic. I guess what is quite unusual here is that there was a 9-year-old child that was undergoing this cosmetic procedure, and her mother was openly discussing why she was having it. And I would say this is quite a controversial area. When I first came across this article, I had to be honest with you, I thought, is it a mistake? Because this child is so young, 9 years old. Is it controversial? Well, really, to be able to make a decision whether to have any kind of procedure, you need to understand what that procedure is. And you could really argue that a 9-year-old doesn't have that ability yet. What are the ethical considerations with this, having eyelid surgery as a child? How does that fit into UK law and UK ethics and governmental regulatory bodies? So, my name is Dr. Julian Silva. I'm an oculofacial plastic surgeon based in London, and facial surgery is something I do every day for my patients. And this video is really for information purposes, and really we're looking at the controversy around this 9-year-old. And I mean, why do this surgery? Well, the purpose of doing Asian blepharoplasty is really to open up the eyelid, and it makes the eye look more attractive. It makes the eye look larger, more feminine. That would be the reason for doing it. But could a 9-year-old really understand what that procedure is and what's involved? And there is footage that follows this, and really, I would say that you really need to have a high level of maturity to really understand what the implications of having surgery, and what are the downsides. And there's always going to be some scarring involved and healing, and there may be some discomfort and pain. And so these are all important considerations. And also, well, what if someone regrets doing something, and if they want to change something in the future? And at least with non-surgical treatments, well, often they're reversible and their effects wear off. And there is a non-surgical type of Asian blepharoplasty where stitches are put in the eyelid, but those stitches gradually dissolve over a period of time. But here we're really talking about a surgical outcome, which is a little different, because that cannot be reversed. Once it is done for good. Now, as a doctor, we take up a code of conduct, and really that is the foundation of ethics and good medical practice. And there are really 4 key criteria when it comes to considering good ethical practice. And the first is beneficence. And beneficence really means to do good for your patients. And to do good for your patients, well, you want to improve the quality of their lives. Often this is the case with cosmetic surgery. Often it can be doing good in terms of healing, in terms of preventing disease, in terms of treating disease. And so beneficence is one of the cornerstones of medical ethics. Non-maleficence, really that means to do no harm. So when giving treatment to a patient, well, we don't want to cause them harm in having that treatment. And you could certainly argue that having facial surgery, well, there is a recovery, there is scarring, there are potential complications or issues with that. So you have to justify doing things in terms of that benefit has got to outweigh the harm. Autonomy. Well, autonomy is the foundation of consent, often very important with surgical procedures, because a patient should be able to understand the procedure, the implications of the procedure, the alternative options, if there are any, to having a procedure. And of course, what is the healing and recovery? What are the potential risks? What are the potential downsides? And may there be a need to do a further surgery, which can be the case in Asian blepharoplasty. And finally, justice. And that final cornerstone is, well, to ensure fairness in terms of medical treatments. So I think, from an ethical perspective, certainly Asian blepharoplasty or any cosmetic surgery in a child under the age of 18, well, you could really want to consider each of these four cornerstones and see whether that person is able to comply with them. Now, this child who underwent eyelid surgery, well, usually, or what was thought to be a 20-minute procedure, actually was complicated. And this surgery actually took 2 hours to complete. And so it just goes to show that, one can always assume the best, but one should always plan for adverse circumstances. Well, how about in the UK? How does this fit into UK regulation and law? Well, in the UK, you have to be 18 years old to have a cosmetic procedure. And otherwise, there needs to be a really good definitive reason for undergoing that procedure. And there are a few exceptions. Otoplasty, and that means people whose ears are very prominent and stick out. Well, it's reasonable to do otoplasty in childhood to pin one's ears back, as this may, prevent bullying and teasing at school. And of course, rhinoplasty, well, if a child has a lot of breathing issues or is has an disproportionate nose in terms of may have other issues such as bullying, well, there are some circumstances where it might be suitable to do these procedures under the age of 18. However, it would need to be justified. But by law, one needs to be 18 or older. And even that even extends to non-surgical treatments. And the law only recently changed, but in terms of best practice, you need to be 18 or older to have a cosmetic procedure in the UK. Now, the other kind of interesting things about this is indemnity, because most insurance companies really are looking for your welfare, and by that your patient's welfare, and they often will stipulate the age of your patients that you're treating, and 18 would be that kind of limit for cosmetic surgery. The CQC, the Care Quality Commission that oversees how practices are run, well, that often looks at the criteria of children, and children having cosmetic treatments would be a controversial area in which they would look down upon. The Royal College of Surgeons have published professional standards by which cosmetic surgery should be done, and it's very clear that cosmetic surgery should be done in adults as opposed to children. And then finally, the GMC. The GMC is a regulatory body that oversees how doctors practice, and there's very clear ethical guidance on good medical practice and how this should be performed. And really, childhood surgery needs to be well considered because there are strong ethical principles behind that. So, from a personal perspective, I think consent is so key in this modern age, and we want all our patients not only to get a benefit from having a procedure, but we want them to understand, what the healing is, what the recovery is, and you need to be at least of the teenage years to really comprehend that. There needs to be an understanding, and the surgery should be in the person's best interest. And sometimes, particularly Asian blepharoplasty, that would be more controversial, and you need to be able to discuss complications. I certainly have had patients come to see me who have had Asian blepharoplasty at a young age and have regretted having that procedure because they didn't choose to have it. Their parents made that decision. And so I think that's a really serious consideration because, there's no medical need to do these procedures at such a young age, and sometimes the results may even be better at a later age, because when that child is fully grown, well, the anatomy of the eyelid will also be grown, and so the surgery will be technically more straightforward to complete. And completing that surgery in a much smaller eyelid is more challenging, and hence the scars will reflect that. So I think this is a very interesting kind of debate over cosmetic surgery in children, and I do think there are strong ethical issues that we talked about. And if you have any other thoughts or questions regarding this, please do not hesitate to contact me. Thank you for watching.